So OET is for medical professionals. There, if you are doctors, if you are nurses, if you are pharmacists, if you the podiatrist, occupational therapist, physical therapist, you are uh, recommended to take the OET as your English um, fluency test. So today, let's just talk about the listening and speaking sections. But we are not directly diving into the sample test. Before that, we will uh, give you some materials, the resources to improve your further understanding about the OET test. And I think that's very important for us to know about how we can take history, how we can describe pain or any other signs and symptoms. Before the test, before today's exams, I have sent a WeChat group of there are many PDF files about the common here the common questions to ask the patients, and also their widely used adjectives to describe in some signs and symptoms, or for doctors to understand better from the patients, because most of the patients don't know much about the medical terminology. They just know the easy English. But because we are Chinese, even the easy English in the eyes of the foreign patients, we Chinese medical professionals still feel a little bit challenging. So we are fighting two lines. One is the public English. Second is the medical terminologies. So today we mainly focus on the public English. Honestly, if you have graduated from, I think that you have graduated from your medical schools, definitely. And it's very easy for us to read this kind of very easy English. But it is challenging for most of our doctors to speak, to listen, to effectively communicate with the foreign patients. So we would say that if you can speak very fluently by making use of very easy English, that's okay. That this problem will be solved. So let's just do it. Maybe you will think, oh, it's very easy. But if you think that that's not that kind of challenging, and then you can do me a favor to maybe you can work with me to help those who cannot speak very well. And or you think that, oh yes, what you're teaching or learning is a little bit challenging, you can let me know. Today is the first class, and we just established this kind of online connection for better understanding, better communication, and maybe from today on, some of the students, some of the doctors or medical professionals think that it is necessary for us to separate in two groups. If you think that you are very good at the basics, and we can invite you into the higher level. If you think that, oh, sorry, I cannot understand very well about the very basic medical terminology, very basic English, we can invite you into the preliminary group. So, but today we just invite you together. And but please, I really need your feedback after the class, okay? Well, so before we kick off the listening, we will talk about how we can take a history, medical history, their past, present history, the chief complaints, past medical history, family history, right? And so all of you can read my screen, right? If you can read, just give me feedback, okay?
Yeah,
Yeah,
I
very good.
can see.
Yeah, very good, very good. So we will firstly talk about quickly talk about how we can take history, and then talk about how we describe a pen, and then we will study the listening section, speaking section. During the communication, I really need your uh, partnership. You can maybe invite two of you or three of you to read, to speak, and then this communication will be very dynamic. Okay. So first, as you can see, you can read that snapshot medical history taking method. Here's a look at the chart below and discuss the following questions with a friend. You see the in America, the Europe, Air Pacific, Latin America, and Africa. There, see the medical history taking methods by region. Um, you see the structure form, North America 75%, digital tools 60%, narrative styles 25%. The time spent for average in terms of minutes, the 12.5 minutes. And correspondingly, you can read the table. In Europe, the structure forms 80%, digital tools 65%, narrative styles 20%, time spent for average in terms of average minutes, the 14.2 minutes. The time spent in a European patients 14.2 is the most maximum number. I think let's just directly go to the Asia Pacific. Their structure from 60%, digital tools 45%, etc. I think you can see that the average time spent for every spent the minute only 8.7 minutes. Maybe the time actually less than 8.7 minutes for Chinese patients. Africa, only 5.9 minutes. That's the medical history taking methods by different regions. See, next, I would like ask you, someone can help me to here's the questions. How many methods are known to do medical history taking? And what method is the most popular of all? Which method is the least popular? Which method takes the longest to use? Which method takes the shortest to use? Which region use the structured forms to the most? Which regions really rely on the structured forms, and which regions rely on narrative styles? What can you tell about the digital tools? And based on the table, I would like listen to you to share your understanding. And how about we invite some of you, or you can, you know, you can let me know what you would like to try to answer this question. How about we ask Ethan, Dr. Ethan Wu?
Okay, thank you for the invitation. So I would like to answer the first question. Actually, we
Yeah,
have
please.
a lot of we have a lot of methods to get the patient history. For example, I think the most popular one is face-to-face consulting.
Mm-hmm.
And second, we can use the telephone to grasp the important information from the patient. And the third is that we may take some interview on the internet, like that.
Okay.
Yeah.
So very good, very good. Um, so you're in Guangzhou, as I know that, right?
Yeah.
Okay,
Yes.
very good. Um, so Dr. Charlie, are you with me?
Yeah, I'm here.
Yeah, very good. Well, though, how many methods are you now to do the medical history taking?
All right. From the form above, there are three methods to take in medical history. But
Hmm.
in my daily work, maybe we have more extra. Just like the previous doctor said, the
Ethan,
telephone.
yeah.
Ethan, sorry, Dr. Ethan said, the telephone and the WeChat, some communication applications.
Hmm.
Yeah.
Yeah, most of the time we just a face to face to take the
Yes.
history,
Yes.
right? Yes, most of the time,
Yeah,
right?
in China, in my office, in my hospital, we use the narrative style and face-to-face to interview.
Yes, yeah. That's why the doctor's profession cannot be replaced by AI. Okay, as I know, right? Well, next, which method is the most popular of all? I think the face-to-face communication, structured form. And which method is the least popular, Dr. Devi?
Yeah, yeah. Maybe in our hospital, the structure forms is the least popular.
Mm-hmm.
We share them. We never used this kind of a method to take a medical history from patient. It's rather it's rather hard to perform this kind of communication.
Yeah,
Yeah.
yeah. Just I think most of the doctors just take the history based on their experience. If they just take the structured form, I think the time not enough. Okay.
I know in maybe in United States, many patients will fill in the forms before they go to see the
Yeah,
doctors.
yeah, and I think the basic information, general information of the patient will be taken or adopted by the nurses.
Nurses or secretary.
Yeah, or secretary. Yes,
Yeah.
definitely. Very good. Yes.
Yeah.
And let's go to the next questions. That which method takes the longest to use? Dr. James Lee, are you with me, James?
Yes,
Yeah.
no.
Yeah, Dr. James,
I
would you please, yeah, try to answer the question. Which method takes the longest to use?
think mm, most of the uh, use my time to take the history taking medical history taking is about his symptoms uh, from the first time he take the yeah
Mm-hmm.
can't answer your question
No, pro-
uh, yeah.
no problem, no problem. I think the structured forms will take the longest to use because there are many questions. Um, uh, Next question, which method takes the shortest to use? So let's ask Dr. David Wang Chenwei. Dr. David, are you with me? Dr. Wang, David? If you're not with me, no problem. And I would like you might Yang Xue, okay, Yang Xue. So yes,
Hello.
yeah, Miss Yang. So you're not doctor, right?
Yeah, I'm not doctor. Yeah,
So
I'm working
yeah,
at industry. Yeah.
yeah, Miss Yang. Okay.
Um, yeah. I think the right to focused areas have shorter visits.
Mm-hmm.
Mm, and I think the Africa spends the least average time.
Yeah, because the
Yeah.
time spent
I-
for every patient is around 5.9 minutes, right?
Yeah,
Yeah, it is
think
shortest.
from this form.
Yeah,
Yeah.
from this form. Very good, very good. Thank you for your cooperation. Thank you very much. Next, let's go to, well, it's a warm-up. It's a warm-up. Okay. So the which region rely on the structured forms? Dr. David, are you with me? You have opened your microphone. Dr. David, Dr. Wang.
Yeah. Sorry,
Welcome.
teacher Zhang.
Welcome.
That's not. I'm glad to meet you, to meet everyone.
Yes, welcome.
Mm.
So the question, which
Which
region rely on the structured
region
forms?
rely on the structure form? Which region rely on the structure form? Structure form.
It's just based on the table above the questions.
Yeah. I can see the form. I think previously I worked in China. Structure form.
So what is, well, let me explain. What is the structured form? For example, if a doctor, you will take the history from the patient, first of the name, the chief, chief complaint, and then past medical history, family history, the workup, whatever. That's just got a structured form. Yeah.
I know it's a structure form. I'm anesthesiologist.
Yes.
When I work in a pre-operation assessment clinical, then we can use the structure form.
Yes.
I don't know in the world other region where it's
well, take it easy.
where
Take it
it's the
easy.
most.
Yeah, take it easy. Just to read the table above the questions.
The most in the in the form the Europe is the
Yes.
most.
Yeah, Europe just make 80%.
Yeah,
That's
80%.
80%. The highest percent. And next is North America, and Latin and Asia Pacific 60%. Latin America 55%. The least percentage is Africa, only 40%. It's easy. It's very easy. As I know, this part is for us to warm up. It's a warm up. Okay. And next, thank you, David. Next, which region rely on narrative style? How about we ask Miss Gen? Okay, would you please have a try?
Okay, thank you. From this form, we can see Europe, North America, and Asia Pacific rely on the structure of forms the most.
The next
number
question.
Above 15, above 16%, I think it's the most rely on.
Yeah, but we're talking about next question. Which region rely on narrative style? Narrative style.
Narrative style. Okay, it's Africa.
Yeah, very 60%, right? Yeah.
Yes, yes.
60%. Okay, thank you. Okay. Last questions. What can you tell about digital tools? Let's invite Dr. Charlie, please.
Okay, I'll come back. Talk about digital tools, right?
Yes, last question, please.
Yeah. From I know, the country, for example, in China, people use the digital tools very widely, almost in Europe and North American. We can use several tools, especially WeChat. And I think in China, several hospitals have online clinic. If you add to the online clinic, the first page was the history, medical history. Patients can sign on there, and doctors can know the history before they answer questions online.
Yes, but first, please answer the question based on the table.
Based on the table?
Yeah,
let me see.
above the questions, there's a table of medical history taking methods by region.
Yeah. My question is, what can you tell about digital tools?
That's
Okay.
right. Yeah.
Yes. The North American was most widely used in this table. There are 60%, and the Africa is only 15%.
Yeah.
We can know that from the first one, North America, and the last one, Africa, the people their education from high to low.
Yeah. So I think the Europe is the number one in terms of
Yeah.
digital tool usage, 65%. Next, North America, 60%. Asia Pacific, 45%. Latin America, 30%. Least Africa, 15%. That's all. And you just based on your daily working experience in China and give us your understanding. That's very good. Thank you.
Thank you.
Yeah. Well, today this part is just for us warm up. Okay. Okay. Thank you so much. Next, let's talk about the useful expressions. Again, I have to reiterate that these questions are very easy. Very easy. The point is how we can use them very fluently. And you see that if you can talk to the patients by making use of these easy questions, I think 95% communication problems will be solved. The problem is maybe at that critical moment, you don't know how to express that kind of idea. So just like we ever say that practice makes perfect, right? Practice makes perfect. And next, go to the part B, useful expressions on how to take the history. Learn these expressions about amnesty stages to the patient. What do they mean? When are they used? And I would like ask some of you to do me a favor, read the sentences one by one. In the sentence in the read framework, how about I ask you, Dr. Devin, you can read for us, please.
Oh, my pleasure. Yeah. What brought you here? What can I do for you? What seems to be the problem? I have been having this headache. I've got headache. I've got headache.
Yeah, I got a headache is a British English. I get
British.
headache is American English. Thank you very much. And next, how about I invite you, invited Dr. David to read the next sentences in the POPO framework, in the POPO frame. How long? David?
How long have How long have they been boarding you? How long have you got this? They've been boarded for about 3 months.
Thank you so much. Thank you so much. And next, Miss Yan. Now, on the blue circle in the on the right, please.
Which part of your head is affected? It's around the front here. Can you describe the pain? It's kind of dull,
Down.
throbbing pain.
Yeah. Okay. Don't worry. After this PDF, we will quickly talk about the pain, how we can make use of the words, expressions to describe pain. Actually, yesterday I've sent you the PDF files about how we can describe different kinds of signs, pain, itchy, numbness, whatever. But today we only talk about a pain, throbbing, stabbing, the cutting, the kind of adjectives to describe the pain. Thank you very much, Miss Yang. Next, how about we invite Yan, Miss Gen, to read the sentences in the yellow frame, please.
Okay, do they come on at any particular time? They are usually worse in the morning. Is there anything that makes them better? They are usually better when sleeping.
Perfect. I actually appreciate your pronunciation. Very, I say, American English, like Wonderful indeed. Thank you so
Thank
much.
you.
Yeah, indeed, very good indeed. And next, the green frame. How about we invite James, Dr. Lee, James. Hello, James. Would you please? Yeah, please.
Yes. Is there anything else apart from this headache? What other problem have you got? Well, my wife says that I seem to be a bit deaf.
Mm-hmm. Thank you so much. Thank you, all of you, for your cooperation. And again, it's pretty easy, very easy. But we have to read a lot, practice a lot. Practice makes perfect. Next, now learn this form. What questions are used to ask the information beneath? Here you can see that their surname means family name, or given name, age, sex, marital status, married or not, occupation, what kind of job does the patient take, their present complaint or chief complaint. See that next, what do you know about these terms? 1 to 6. Here AM means morning. What is CO? Charlie, what is CO? I don't know.
CO. I have no idea.
Maybe that's kind of chief occupation or whatever. Let it be. Sex means gender or female, right? Marital
Yeah,
status, marry or unmarried. Dow and throbbing pen. I think here's not pin, but pen, PAIN, pen. And 6, 3-12. This is the rating scale. Like if the total number 12, and then the score is 3. That's kind of understanding. Okay. Now, if we are based on this. The table, like from surname, first name, age, sex, marital status, occupation, present complaint, and just imagine you are the doctor and you're taking the general information from the patient, and how we can, take that kind of information. And let's just randomly choose 2 of you to practice. How about I invite David? You are the doctor, okay? David, this time.
Yeah.
David, Dr. Wang, okay?
It's me. Yeah.
Yeah, you're absent-minded. Okay, Dr. David, now this time you are the doctor, and how about I ask you, Devin, okay? Dr. Yuan, you're in China, I remember. This time you are the patient, okay?
No problem.
Now based on the table here from surname, first name, age, sex, marital status, occupation, and present complaint, Dr. David, Dr. Wang will ask you this information. Please. Action.
Hello. I'm Dr. Wang. I want to know what's your name?
My name is Devin.
Oh, David. How old are you?
How
How old are you?
age? 40.
40. Yeah. What's your feel uncomfortable?
I got a pen on my knee.
Pain? The pain, how long?
About 1 week.
1 week.
Yeah.
Oh. Can you describe the pain?
Yes, of course. It's something like acute and
Cute. Yeah.
yeah, it's acute. It's getting worse at night.
At night.
Okay.
I want to know what's your operation, what's your work,
I mean, I'm a farmer.
your job, farmer.
Yeah. I pretend to be a patient. Okay.
Yeah, sure. I know.
Okay.
Thank you. Thank you.
So thank you, both of you. Very good. Very good.
Mm.
I know you have tried your best, but there are much room for you both to improve, especially for Dr. David, because now you're the doctor. Because you see, when you take the medical history from the patient, first you gotta introduce yourself, and there are many ways to introduce yourself. Hi, this is Dr. David. I'm very glad to see you. Can I have your name? In that kind of sense. But yeah, even though you can take the general information from the patient, but in the eyes of the professional like OET trainer, your questions is a little bit hurry, and you see, we will like directly go to here. I think that you can read my screen. I would like to make use of the PowerPoint to share how we can join or prepare the OET speaking. And you see that when you speak, when you want to do the interview with the patient, first you gotta calling the patient by his or her name. If you don't know his or her name, first you ask the name of the patient and introduce yourself. And remember, shake hands, okay? Shake hands and have eye contact. Keep the smile, eye contact, shake hands, because in America or UK or Australia, the patient is called a client, right? It's called client. So the relationship between the doctor and the patient are equal. And to some extent, the doctor will treat the patient a little bit higher, or at least respect, equal. Okay, so yeah. So introduce yourself. If you don't know the name of the patient, kindly ask, can I have your name? What's your family name, surname, so that I can fill the names into the form, and then shake hands, have eye contact, show your professionalism. And I think you ask if you speak very not just professional, but politely, and speak not too quickly. You got it clearly, okay? So next, yeah, I think that you can see that the interview should be patient-centered interview. Briefly, PCI, patient-centered interview, not doctor-centered or disease-centered interview, but the patient-centered. That's very important principle. So when you talk to the patient, you have to reflective listening and setting a joint agenda with the patient, connected with the patient. But no matter what you will talk with the patient, you got to let the patient know that he is the centered the figure when you talk, not you as a doctor, okay? And also, I would like to share with you one very, very important abbreviations. Also, you can regard as a pause. When you have the interview, because the taking history is part of the interview, and you just remember the PEARLS, the 1, 2, 3, the 6 rules. The first, you got to show your partnership. Okay, when you talk to the patient, you are the partner of the patient. Number two, empathy. I'm not sure that you can, would you please give me your understanding of what is the empathy? Dr., how about we choose Dr. Charlie?
I'm here.
Yeah.
The empathy means when the patient told us where they got the uncomfortable pain or something else, we must repeat first. I'm sorry to hear that.
Yeah. Very good. Very important. So please do not under-evaluate. I'm sorry to hear that. When you see I'm sorry, the listener, the patient will say, oh, the doctor show his understanding, empathetic on my awkward situation. He will feel close to you as a doctor, right? Feel you are a doctor. So it's very, very important. I'm very sorry to hear that. That's pretty important. So empathy is shown by the doctor. Not, you can present your not acknowledging and showing your understanding of the patient's feelings, understanding his feelings. For example, you might respond to a patient who express fear or anger with oh, that sounds hard, or you look upset. You see, it's not just English. It's about your empathetic ability, your understanding the terrible, horrible, or awkward situation of the patient. So, oh wow, that sounds terrible. You look upset. How can I help you? You see that this very easy English can show your empathy. And next, A for apology. Apology, I think when you make mistake, you show I'm very sorry. But here, apology means you taking personal responsibility when it is appropriate to do so. Like I'm sorry I'm late, or I'm sorry this happened to you. To some extent, it's very close to empathy. But I think that as a doctor, you say that way. I'm sorry I was late. I'm sorry that this happened to you. Actually, it's not the strictly kind of apology, but also you are showing your empathy. You dare to take the responsibility, right? And next, R, certainly to show your respect, no matter what the patient is or the person is. We got to respect everybody because we're equal. I think respect means valuing the patient's choices, behaviors, and decisions. For example, if you think the patient should to take the surgery, but the patient choose the conservative medications, and you got to show your respect to his choice. Maybe you can see, I respect your choice, but I have to point out that kind of problems you will face. But I respect your choice. So next, legitimization. I would like to challenge you. What is it? What is it? Miskin, and please tell me, what is legitimization in the eyes of the doctor? Oh, in Chinese, legitimization in Chinese 合理化 ，OK？
Yeah, 情绪合理化，就是要认为患者其实他难受或者焦虑是可以的嘛，就是比如说我们在健管中心，对对。
I know you know. Wonderful. In English only, we speak English only. Okay. So
Okay.
no problem. legitimization means we validate the patient and shows understanding of his or her feeling and choices. An example of the legitimization would be something like many of us would be confused or upset by this situation. When the patients feel upward, feel confused, and then you see, hey, I have been confused or upset by these situations too. And then you see immediately that the patient will think, oh yes, my understanding is not that kind of stupid, because the doctor has this similar or same experiences before. So you are legitimize the patient's thinking or understanding, and then you can quickly to make the awkwardness disappear. This is a legitimization. Last, support. I think this is very easy to understand, but still, I would like ask Dr. Ethan Wu. Dr. Wu, would you please show me your understanding about how doctor can show his or her support to the patient?
All right. Actually, I think it is kind of hard for me, especially I practice in China, because I will try,
Yeah,
because
please, no problem.
yeah, because we can maybe we can talk to the patient, say, I understand what you said, and that I understand your feeling, and maybe if some patients encounter some for example, encounter some family violence, so maybe we can offer there some suggestions to find help to the police, or some guidance to them, like that.
Good, very good. I think as a doctor, we just provide the medical service for our clients or patients. No matter what,
Yes.
to provide the adequate professional support is our duty, right? So support should as a doctor, should continuously be offered to the patient, and we can offer support by saying we're talking about speaking, by saying something as simple as like I will be here when you need me. I will be here when you need me. You see, that's very simple. But in the eyes of the patient, they think, oh yeah, the doctor can be depended by me, because he said he will be here when I need him or her, right? So just remember, I will be here when you need me. It's very easy to show your support to the patient. So here again, I suggest you to write down the PUL, PEL PUL. It's very decorative for the young lady. Have a pulls around his neck, but here PUL, P for partnership, E for empathy, A for apology, R for respect, L legitimization, S for support, and we will, according to these principles, to make use of various kinds of the sentences to show our understanding of these 6 principles. And see again, let's just review the procedures, how we can take the history. Here's the first, make the introduction. Again, if you get the door, get the room and knock the door, verify the patient's name, introduce yourself and shake hands, make eye contact. That's pretty important, eye contact. And drape the patient and cover the legs. It's not required in a daily clinical interview. But next, what history you can start with an open-ended questions, then focus on key organ systems, like you can ask what kind of frequency, onset, relieving factors, duration, precipitating factors, or what kind of factors can make the signs or symptoms worse, or associated symptoms, the pen can radiate into the other parts of the body. The previous episodes before you visit here, and what kind of signs or symptoms you have experienced, and what kind of progress you have gained in the past times, and how to get the medical history. The first, avoid technical medical terms, because when you talk to the patients who are laymen in medicine, we should avoid the medical terminology. We just as much as we can to make use of very easy English, public English. And we show empathy, certainly, and address any patient concerns to show our pulse, legitimization, support, respect, apology, etc. And maintain good eye contact. Also, maintain eye-good contact. Because we Chinese, I would say, generally are shy, introverted, and we dare not to have eye contact. But I think that's when you talk to the foreign patients, to have eye contact, smile, shake hands, say hi. Hi, this is Dr. Charlie. This is Dr. Ethan, Dr. Devin, Dr. David, Dr. again, Dr. Wan, whatever. And then this is very natural, very professional, very kind, I think. It will form your daily habit. But please do not interrupt or rush the patient. If the patient want to speak, and you got to keep listening. Yeah, because interrupt others' words is not that kind of polite, right? And certainly after the taking medical history, you got to perform the physical exam, right? Physical exam, summarize the history, ask if there's anything that was not covered, ask if patient has any concerns or questions. This is the procedures, how doctors can take the history, And yeah, we just review the procedures, very important procedures. Yesterday, I give you the common questions to ask the patient. If you have not received the PDF files or the WeChat public account, please let me know. I will send you immediately. Okay, no problem. But because there's so many here it is. Here is common questions to ask the patient. And here, yes. And how, yeah, but I will just practice several of them, like opening the encounter. How about I ask again, Charlie, would you please do me a favor to read the opening of the encounter?
Okay.
Thank you.
Mr. John, hello. I'm Dr. Singh. It's nice to meet you. I'd like to ask you some questions and examine you today. How can I help you today? What brought you to the hospital or to the clinic today? What made you come in today? What are your concerns?
Yeah, thank you so much, Dr. Charlie. When you read, I can sense that you are a little bit hurry. Don't worry. If you made a lot of practice and you see the patients, it will feel very natural. Generally, like Mr. William, Mr. James, whatever. Hello, I'm Dr. Blah, blah, blah. It's nice to meet you. I think it's very like highly used self-introduction. And then you immediately say, I'd like to ask you some questions and examine you today. It's very natural. I think it's a very good opening for doctors to encounter the patients, okay? And today we will focus only on the pen because we have come to this PDF. We just make use of this one and then to share the sentences to ask the patients. I would like to ask Miss Yang Xue, would you please read for us?
Okay, I can read. Do you have pen? When did it start? How long have you had this pen? How long does it last? How often does it come on? Where do you feel the pen? Can you show me exactly where it is? Does the pen travel anywhere? What is the pen like? Can you describe it for me? What is the character of the pen? For example, is it sharp, burning, cramping,
Yeah, cramping.
or pressure-like? Is it constant, or does it come and go? On a scale of 1 to 10, with 10 being the worst pain you have ever felt, how would you rate your pain? What brings the pain on? Do you know what causes the pain to start? Does anything make the pain better? Does anything make it worse? How have you had similar pain before?
Okay, let's go to the next page. Okay, that's all for the pen. Thank you, Miss Yang. Thank you so much. About the word about the word cramping. It is in Chinese 绞痛. Okay. For example, a female patient in his menstruation, the female patient will feel cramping around his uterus or womb area. This is cramping, the meaning, 绞痛, okay? And there are many words to describe pain. I would like directly go to the parts. After that, we can have a rest. Here, this is the PDF. It's about pain, and let's directly go to the words vocabulary to describe the character of the pain. Here the words. There's no need for you to write them down. After the class, I will send you the PDF files in the WeChat group, and you can down and drag them, the PDF files, into your computer, local computer. Don't worry. But we will one by one review these words, because they are very frequent for us to use and understand the meaning of that. Because you see, when the patient describes his pain or her pain, and then you're gonna understand what is the adjectives is describing, what is about, right? Next, let's ask James, Dr. James. Yes, James. Yeah, we're talking about the characteristics of the adjectives to describe the pain. And first, would you please just share your understanding? Read it first, and then what is mean? What kind of diseases or signs or symptoms we would like to make use of the adjectives? The first, beating, right?
Yeah.
Beating. And you can beating, you can read. It means that heart beats, throbs, right?
Yes.
And next.
Boring.
Well, here boring is not like the film is boring, whatever. But here boring means to drill, just like the drill to penetrate your skin. It's very painful. And actually, you have not read the second one, biting, like a bee sting, right? Being sting. Yeah. The fourth one, burning.
Like was fired. Burning like fire.
Yeah. Like a fire in the body is burning, right? Okay. It's as in cystitis or ulcer. I think that you have the stomach ulcer or duodenal ulcer. It's like the heart is burning, right?
Yes.
Yeah.
Yes.
Very good. Thank you. Thank you, James. Let's just invite another person, another doctor. Dr. David, are you with me?
Yeah, I'm here.
Yeah, thank you. And then would you please share your understanding about the next words, bursting? Here I would like to dial, okay? This word.
Bursting. Sorry, bursting.
Yeah, what's the meaning bursting? Bursting means that's
Bursting,
Mhm.
bursting means
explode, bomb, right?
explode.
Yeah, explode,
bomb.
bursting. Yeah, bursting, bomb. Okay, okay.
Bomb.
So yeah, you see that because we're Chinese, and then when they talk to taking medical history from the patient, if he or she used the bursting, and then we don't understand what they're talking about. Actually, it's very easy, right? Yeah. It is possible, right? It is possible. Thank you. And next, please read on, and then you can give me your understanding what kind of signs or symptoms that will have the colicky characteristic.
Colicky, abdominal disease. Colicky. Colicky, for example, herniate.
Yeah, herniation.
Herniation,
Hernia, yeah.
colic.
疝气
Colic. Yeah. 疝气个
colicky 绞痛
Chinese 绞痛
yes
Colic.
abdominal disease is like a hernia. You got a very colicky herniation. You can imagine. I do not have this kind of diseases, so I cannot imagine that kind of pain. Yeah,
I can't use
but I know
English.
its meaning. Yeah, it's meaning. Yeah, very good. Next, cramping. When Miss Yan read the sentences, cramping generally refers to the spastic or colicky like pain for the female menstruation. 女性月经期间的 cramping. Yes. Cutting. Like a rectal disease, just like that rectum or colon, right, has been cut. Yeah, this kind of thing. Dragging. What is dragging?
Dragging.
So as we know,
Chinese.
yeah, please.
La.
Yes, that's right. Drag. But you see that when we talk about the pain of the intestines, large intestines, small intestines, if you just cut the small intestine or large intestine, you don't have any pain. But if you drag the intestines, you will feel pain, right? Yeah, right. Okay, this is dragging. And next to joint, what is joint? Joint is, I think, is similar to dragging.
Yeah.
It's dragging. Okay, thank you. Next, Dao. Most of the tumor patients or cancer patients, they feel pain, but that pain is not sharp. Sharp is antonym of Dao, where like a headache or tumor, the pain is not very sharp, but very Dao. Okay. Yeah. And Noi, G-N-A-W, Noi. Noi is, anyone know what's the meaning? Noi, G-N-A-W. Here, G is voiceless. Noi means bite, right? Yeah, it's bite. Like a biting. Okay. Next, grinding. What is grinding? Dr. Ethan?
I'm sorry, I don't know about that.
Well, I think that grind is, it's like make the friction, 摩擦, okay, friction between the two stones. This is called grinding. Okay. Okay. Next, gripping. See that as in angina pectoris. gripping is, it's like hold very tightly. Okay, gripping, very hold it tightly, just like the heart has been gripped very tightly when the patient got angina pectoris, in Chinese 心绞痛. Okay, angina pectoris, the disease name. Heavy, as in premenstrual. A female, when in his menstruation before the period, his lower abdomen area around the pelvis will feel heavy, right? Knife-like, easy, numb, lack of sensation, piercing. It's like a penetrating piercing, and the disease like angina pectoris. Pressing, press, push, suppress, control. Okay, press the button. Prickling, like pen and a needle in inflamed eyes. Like the disease is conjunctivitis. 结膜炎 conjunctivitis. Scalding. Scald means like a very hot scalding in a disease like cystitis. Severe pain, gip. It gives me a gip. That's very severe pain. Gip. Sharp. It's the antonym of dull. Cut or lacerate like a knife. Use the knife to cut the muscle, cut the skin, right? You get a very sharp pain. Shooting. Their disease called sciatica. Sciatica is the disease is called what is sciatica, Devin?
In Chinese?
Yeah.
坐骨神经痛.
Definitely, very good, very good. Next, we will have the listen, and then there's a conversation during the interview that the doctor will mention sciatica, 坐骨神经痛, toothache. We can use the verb shooting. The pain of the sciatica is shooting. Okay, so next we'll come to the end of the words. Sickening, smarting, burn, sore, stabbing, stain. And stain is the words usually used. Cuts, stings. Stitch, spasm, inside due to the excessive exercise. Straining, tearing, tender in Chinese 压痛, right? Throbbing, headache. Tingling. Here words tingling. Return of the circulation of extremities. That if there's the extremity do not have the adequate supply of the blood, the extreme, like your upper or lower extremities, your hand, your fingers, your toes will feel sensation, pain, tingling. Okay, twinge, sudden or sharp. Well, that's the words we would like use to describe the pain. So many, but don't worry, you are not required to remember all of this. But I think since we are the online training, my purpose is that to give you more, much more than you can expect. But it's really need time to make use of them. Depends on time. How about we just have 5 minutes of break, and then come back. We will formally kick off the listening section, okay?
Okay.
Okay, thank you.
Yeah, have a break, 5 minutes, come back.
Okay.
5 minutes.